Hi, I'm Dr. Tom Hendrickson, and I want to show you the Hendrickson Method protocol for the assessment and treatment of the hip that's lost range of motion. So first of all, we're going to bring the hip up to 90 degrees of flexion, the knee to 90 degrees flexion. This technique, by the way, is contraindicated if there's already been a hip replacement. You don't do it. First of all, the assessment is we're going to take the hip out. I'm going to pull the leg out this way. This is internal rotation because the head of the femur is turning in this way. And you can see where this is about 15, 20 degrees, 90 degrees is out here. Typically we have about 35 degrees of internal rotation. And then I'm going to turn the hip this way into external rotation because the head of the femur is turning out. And this is 45 degrees about, which is the normal range. So now I can tell that the limitation in this internal rotation is from the joint capsule, because when I come to the end range, there's an end feel to it, and it feels leathery. It's not just because of a tight muscle. It's not because there's bone hitting on bone. That would be a hard end feel, so that would be a very arthritic hip. Whereas this limitation here with Luke is because of a tight capsule. And because the muscles interweave with the joint capsule, we can increase the length and extensibility of the capsule through the muscle. All right, so what we're going to have her do here is, the first rule is it should not be painful. Luke's going to tell me if this hurts in any way. And I'm going to tap here because I'm going to try to pull his leg out toward me, and he's going to resist me, and I'm going to stabilize with this hand. So Luke's resisting, and this is not much effort, just modest effort, and then relax after about 5 seconds. Then you wait a few seconds. That's a refractory period. And now Luke, you relaxes. I'm going to stretch him a little bit more. And then I'm going to tap to give him a cue for him to resist. I'm holding here with this hand here. I'm pulling toward me with this hand about 5 seconds. He's relaxing. And then I wait a few seconds, and then you relax now, Luke, because I'm going to stretch you. And you can see how we're increasing the range of motion here. Let's do it one more time. So Luke, resist here. So I'm stabilizing with this hand. It's isometric. There's no movement and there's no pain. And then relax. And then you relax now because I'm going to put one more stretch on it. And see how we can stretch the capsule? And now we've got the normal range of motion in the hip, whereas before he had lost about half of his internal rotation. So that's the Hendrickson Method protocol for the assessment and treatment of loss of motion of the hip.